Hi everyone, can I get a thumbs up if you can hear me out there? Yay! Thanks very much for joining us today for the second webinar in our new series of online events. My name's Nell Thompson and I'm the Secretary of the Australian Institute of Animal Management, and I'll be helping with the technical side of this webinar today. I've been on the AIM committee since 2013 and I'm also the coordinator of the National Getting to Zero program. The Australian Institute of Animal Management is the national peak body representing local government animal management officers. The AIM committee consists of a wide range of professionals engaged in various aspects of animal management. AIM seeks to support those engaged in the business of animal management and the function itself by providing training and information, opportunities for networking and collaboration, and by encouraging the use of best practice policy and practices. AIM understands the significant pressures placed on local government and not-for-profit rescue and rehoming service providers when working in the companion animal management space. We welcome new members, and people can join via our website at www.aim.org.au. As you probably know, each year the AIM committee put together a 3-day workshop consisting of conference-style presentations and practical training sessions. We have, of course, had to cancel the 2020 event due to COVID-19, but wanted to ensure that our valued members still had access to education. So we've worked on putting together a series of webinars for that purpose. So to the agenda today. Once I hand over to our presenter, there will be around 60 minutes of presentation and 15 odd minutes of question time once the presentation's concluded. The recording of this webinar will be accessible via our website to all members to watch at any time. We're going to ask that everyone mutes themselves during the presentation, unless Kristen indicates otherwise. And if you have any questions, you can start putting them in the chat box and we'll get through as many as we can at the end of the session. If you've got very quick questions that relate to your understanding of the content, we'll try to get to those during the presentation. And if you have more questions or we don't get to yours during the question time, you can also send a message to our Facebook page and we'll get to it that way. We ask that you excuse any working from home noises such as barking dogs or anything else that might be happening in the background. Just ignore and move on. So to our presenter for today. We are very excited to have our first international presenter with us today, and we're super grateful for her generosity with her time, as I'm sure after a long day, she'd much prefer to be sitting on the couch right now. Kristen Hassen is a National Animal Care and Control Association board member and the Director of Animal Services of Pima Animal Care Center, the municipal shelter in Pima County, Tucson, Arizona. Kristen oversees animal control and shelter services. Her areas of expertise include building pet support services to reduce intake, strategic communications for executive leadership in animal management, creating and implementing best practices and model programs all over the world. She teaches students from all over the US and around the world who visit PACC to learn about building model programs in a high intake government animal shelter. Look out for future webinars from Kristen. We're hoping to lure her back. She has actually presented and been to our shores. She came over last year for G2Z 2019. We hope to get her back in future for an AIM event. So over to you, Kristen, and welcome.
Thank you so much, Nell, for the kind words, and thank you so much to everyone for having me tonight. I'm so excited to be here with you and talk more about animal sheltering in the age of COVID. I've asked my colleague and friend Steve Zeidman to come, and I'll let him tell you about himself, but he is a mentor to so many of us in the movement and is going to offer an overview of the national data since COVID. And we felt like this was important to kind of set the stage for what I'm going to talk about so that you can see all of those national trends. So I'll let Steve take it from here.
Thanks, Kristen. My name's Steve Zeidman. I am I'm going to do this. I'm going to try to also start sharing my deck. I am the Senior Vice President for Software Solutions for a company called Pet Health. We are the makers of of 2 brands of software here in North America, which includes PetPoint software and Chameleon software. The data that I'll be showing you guys is 100% of our PetPoint clients and a spattering of our Chameleon clients. Just for those who are more technical, PetPoint is a web-based product like Shelter Buddy, as you guys probably know well in Australia. Chameleon is an older product that's client server based, so we actually the clients have to opt in to send us their data. So, but it represents around 1,200 shelters. And I know that for this group, it's important to know around the animal control, it's around 400 of these organizations are either government entities or have the government contract. They're a private agency that has a government contract. So it is pretty well represented data. So I know sometimes people will just assume that, oh, it's private, maybe it doesn't apply to us. But what we found in all the trends that we looked at in other data sources, it really is very well represented of what's happening here in the United States. So, from there, I gotta jump into the data, and hopefully now my screen will advance. All right, so we've been tracking the data since day one. So like it says, most of this data is data that we have housed on our servers, so we could see that historic of both last year versus this year. So all through the presentation, you'll see the dotted lines are those from last year, and the solid lines are for this year. And then depending on the slide, and I'll try to make sure as we go through it, what we're looking at. So in the United States, basically, if you look at 3/14, which is the third date on here, that was when the U.S. federal government declared the emergency. So that we put kind of 2 weeks before that just to get a sense of what was happening. As you can imagine, when it comes to both intakes and outcome, you had a massive drop in intakes and outcomes for both cats and dogs. With cats, as you would recognize, this happening in March, you have the seasonal trends that always happen. I assume you guys probably have the opposite in Australia. Normally in the springtime, we would see the increase of cats. So you really do see that it very quickly, although there was a drop with cats, it did quickly come back up and then started to mimic the trends from last year, but just at a much smaller level. Now, our data gets a little squirrely towards the end here, and that's because of specific things happening in the United States. In the United States, there is a major event called the Clear the Shelters event. It's actually brought to us by NBC, which is one of the major TV networks here. And, probably 400 or 500 shelters participate in that event every year. That's usually a weekend in-person event. So you had this massive spike last year in the numbers. And then we go into the holidays. So what's really interesting, and I don't even think we knew this until we started to really look at the data on a weekly basis, because we would normally look at it on a weekend basis. These drops in data sets that you see here, that's 4th of July in the United States, so Independence Day. And then we just having our Labor Day. And that, so it's off by a week here. We do expect this to bounce back. So these seem to be following normal trends. But if you look at the numbers compared to prior years, you could see we're still way below where we were, but they still seem to follow the same trends. With dogs, really the same thing. You had a huge drop off. As you could see, in general, dog intake is relatively stable depending on what's going on. But as you can see there, it's slowly coming back, but it's still very, very slow in the return. So the difference between the number of dogs and cats in the shelters, and you'll see this through the data, is remarkably different. Cats are returning pretty darn close to the level that they have been. Dogs remain dramatically less. If you look at it, we break it down for 2020 data by the intake type. You could see the fact that it still pretty much follows the same patterns there. You had a massive jump, you had a massive drop, and then a build back up. Stray continues, it outpaces owner surrender and return pretty dramatically. And you'll see that both for the intake for 2020 versus 2019. You lose that jump, but it did just go right back to the same level that you saw from prior years. And if anyone has questions, feel free to jump in and disrupt me. Otherwise, I'll just kind of keep going because I know that you've got a lot of stuff to cover, so I don't want to take up all your time. Dog intake trends versus 2020 to 2019. Again, like I said, you very much see, no matter what the level is, no matter what the category is, it's pretty stable in the U.S. When it comes to dog intake. But that's, of course, not what we saw this year. We saw the massive drop, and then it continues to remain low. Outcome trends. Here, again, we're starting to see some of the same patterns. You get the drop, particularly, obviously, when it comes to adoption. You had a massive drop in adoptions, and then you slowly have a build back up over time. Again, you see those holidays really do impact adoptions, and then with dog outcomes, you have that drop, and that continues just to stay level. We use things that we call sort of the number of adoptions and RTOs based on intake. So this is the idea, is sort of an efficiency of what percentage of the pets get placed. So the good news through this whole thing is we are generally trending above what we were last year. We're getting more animals based on the number of intakes out the door. This last bit through this period will be interesting to see how we watch. We've never really paid attention to the impact of a major national event like a shelter, like a Clear the Shelters event, and how it impacts the numbers. But we'll see over time if this continues to remain below the numbers. I think it will. So basically, we are getting more animals out through adoption based on the percentage of animals coming in. Even though adoptions are down, we're adopting a larger percentage of the animals that are in our shelters, which is great news. Here's where the data gets, I think where the data gets a bit interesting here is foster start. So this is how many animals were sent to foster in that month. So it's been big talk about, foster has been our big savior through this event. And there is no doubt that is absolutely what was true at the very beginning of this crisis. Lots of animals were sent out to foster. As you could see, this huge bump really on the few weeks after the federal disaster was declared. Tons of animals were sent out to foster. And then it started to trickle down. And very quickly, the rate of the number of animals in foster, or I should say that were going out to foster, started mimicking last year's numbers. Now this isn't because of like less work being done. It's just the fact that there's less animals coming in. And that's what we see here. There is this diversion here. We don't know if that's just a holiday piece there. We'll see if it comes back in line or if that becomes a new trend. But it is interesting that we saw a particularly drop in this last 2-week period, and we'll continue to watch that and see what happens. this is where we look at animals in care. So how many animals are currently in the shelter through these periods of time? And these tell some really interesting stories. We have both, there's two lines on the graph. One is animals in foster, so that means the foster population, and the other is in care, which means physically in the shelter buildings. And you could see the normal trend is you would have, particularly during the spring, we have this huge growth of population of cats, and we adjust for that by having lots of animals go into foster, right? That's the general trend that we see. Obviously, this got very disrupted, and you can see how it quickly aligned the number of cats in foster very quickly. I mean, basically by the beginning of May, already just aligned with where we were in the previous year. What has remained continuously low is the number of animals physically in our buildings, which is all, this is good. This was good news in how we were managing, the care of animals, right? Very important to that. But it also tells us that the story is that there really is fewer animals coming into the shelters and how it has impacted the overall population. With dogs, you could see we have this very stable trend line usually with dogs, both in the shelter and in foster. The dogs have not yet returned to the same level they've been been before, but it's very close and it stays, just a little bit higher and pretty stable, a bit higher. But as you can see, the number of dogs in care is slowly moving back to last year's level. So we're continuing to watch that. So that is the data that's based on PetPoint and PetPoint and Chameleon data.
We have about another 3 minutes, Steve, just.
Okay, I'll do this super fast because this is super interesting. So sorry, I'm talking too slow. I have too much data here, so sorry. I only have 3 slides here. This is Adopt a Pet. This is the second largest adoption website in North America, and they've graciously provided some data to us. So you can see, so we think about the supply, which is what we were talking about with what's in the shelters. This is about users and their interest in animals. It dramatically jumped through the crisis. In April, they saw, basically almost tripled their traffic on their sites. So tons and tons of interest. They've now come down, but they are still at 41% higher interest in animals on their website. So this is really kind of interesting. You can see here it's kind of much smoother lines when you look at it month over month. Now there's another way to look at it. This is people, they have something called a pet inquiry form. So that means that they actually said they wanted to look at it. So it wasn't bored people just looking at cute pets to cheer them up. These are people who put an inquiry about that pet in there. And you can see the numbers are actually even higher. That percentage really does jump up 74%, which is pretty amazing. And the last one is rehoming of animals. So they have on their site, they have the ability to do peer-to-peer rehoming of animals. So it's, I think, a good number to see how it's impacting people from at home. And what you can see is that during the crisis, actually, the interest in rehoming their pets actually dropped dramatically. So whatever it was that was a lot, having people need to relinquish their pets, they didn't need to do that during this crisis. It slowly has built back up to a more normal level, but right now we're not seeing it go beyond the normal level. So it's interesting there. So we are concerned that people might, with jobs, might be losing their homes. But we've yet to see anyone preemptively, at least trend-wise, preemptively trying to rehome their pets. So that's good news. And I think that is the last of my slides. So great.
Thank you, Steve, so much for that. And we have a lot more to get to tonight, but if you do have questions for Steve about that and want to send those to No, we will make sure we get those answered for you. Steve, is there anything else you want to share before we move on?
No, that's it. I appreciate the opportunity to share the data. I think it's been pretty amazing to see the response to this and be able to help. So we're very happy to do it.
Thank you so much for joining us. Appreciate it. All right, well, you're welcome to stick with us, but I imagine you have things to do, so feel free to hop off whenever. And for the rest of you, I'd love to see your faces. I don't get to see real people very much anymore, so please, if you want to share, turn those cameras on, because it's nice to see everyone so I don't feel like I'm talking to myself. My name's Kristen, and I have been directing municipal government shelters for the last almost 9 years. Many of my colleagues went into private sheltering, and I sort of stumbled into municipal sheltering, but I have found a love for government sheltering, and we're the ones that we don't really have a choice, you know, whatever comes to our door comes to our door, and we kind of take what shows up. So I currently run a shelter let me see if I can get my slides to move. Okay, so if you're familiar with the US map, the shelter that I run now is where this little yellow dot is. That's in Tucson, Arizona. And the reason that is meaningful is it's the largest shelter that I've ever run. We take in about 20,000 animals each year. And that is significant because it's actually a pretty small town. It's geographically large. It's about 9,000 square miles, which I don't know what that translates to in kilometers, but it's about the size of, if you look up here, it's about the size of one of these states. So it's a really large county, and it's the largest stretch of the US-Mexico border. So if you've been reading any of the US news, all of the people being detained and the border wall and all that terrible stuff that's happening in the United States right now is actually happening right along here, and that's my county. So this shelter, it takes in about 7,000 cats and about 13,000 dogs on average. And sorry about my Facebook. I'm not really trying to turn that off. Okay, so here's a little bit about our shelter. We take in about 19,000, 20,000 animals. We do 26 to 30,000 animal control calls every year. License about 70,000 dogs every year. We have an $11 million a year budget, and the population here is about 1 million. So that's PACC, and this is our lobby. So even though we're a government shelter, we do everything, because we used to just sort of take in animals and transfer them or euthanize them. Now we do adoptions and foster, and that's pretty typical for most government shelters here now. So I'm going to focus tonight on a couple of areas that I think will be relevant to you, but just to touch quickly on where PACC is at. So we used to euthanize a lot of animals. We used to euthanize 15,000 animals a year. Now we're down to fewer than 1,000. So we're really proud of that. The community doesn't want healthy, treatable animals to be euthanized, and we as an industry had to catch up. So this past year, we saved a little more than 90% of the animals. So we reduced, for instance, dog euthanasia from dogs were, when I got to PACC in 2017, we were euthanizing 2,500 dogs a year, and we're down to about 500. And the reason I'm mentioning that is because we, as a government animal shelter director, I'm very, very focused on public safety. Public safety is our #1 priority, and we are always paying attention to what animals are biting, what's going on in our community, are people really safe? And we found some interesting data. So we save most dogs. We don't euthanize even dogs that have some histories of behavioral issues or minor bites. We don't just euthanize them. But we were worried as we stopped euthanizing so many dogs, we were worried that we would see a change in the bite data. But you can see here, this is our adopted so these numbers are how many dogs we adopted each year, and this is the total number of bites of those adopted dogs. and the percentage of dogs that bites post-adoption remains very, very small, even though we're euthanizing far fewer dogs. This is our euthanasia graph. So this is the version of the graph I showed you earlier, but you can see as euthanasia declines, we're also paying attention to this line on top. This is the total reported bites in our entire community. So this is any animal that has bitten. And you can see this has gone down a bit. It has not gone up. And the last bite statistic is that we also pay attention to what's happening inside of the shelter. And we have seen no measurable increase in dog bites in the shelter or in the community. So that all sort of sets the stage for why we do things the way that we do. Okay, so our shelter takes in everything, and most animals get a chance at life. So this little kitten is going to get medical care, treatment, and get adopted. And this dog you can see is in a wheelchair. All of this stuff is donated. We're a government-funded facility. We're funded by taxpayers. We don't have money to pay for these things, but they're all funded through donation support. So you heard Steve talk a little bit about foster, and most of you are probably like, yeah, we don't do foster. But we have really rethought this since COVID. This is the graph. So this is, again, a version of that euthanasia graph I showed you, but that green line represents the number of animals we put into foster care. And foster has been a key solution for us because it's allowed us to save money. It's prevented shelter decline, and it has also improved the safety of the shelter. So we send about 5,000 of our animals into foster homes every year. They go to the foster home, and the foster carer actually gets the animal adopted themselves, and the money for the adoption fee just gets sent to PACC. So it's actually allowed us to save a lot of money we used to spend caring for animals, and to use that money for other things. So we do a lot of adoptions. We adopted out 13,000 animals last year, and we found that transferring animals to rescue just wasn't enough. So now we do our own adoptions. But if you're considering something like this, PACC is in a very, very poor community. It's the 5th poorest city in America. And up until about 3 years ago, we didn't have any paid staff. It was all volunteers doing adoption. And so for 10 years, we did adoptions only through volunteers. But we do too many now for that, so we have staff as well. Okay, so one of the trends that's been happening before COVID was an increased intake due to evictions. So these are people being removed from their homes. And if you've been following the US news at all, you know we're about to face a massive eviction crisis. It's been pushed down the road to January, but we're looking at anywhere 20 million or more people potentially facing eviction. The numbers are really unthinkable. And that's concerning because in the US, 65% of people own one or more animals. So if you think about what that could add up to, what it looks like for us is that we're looking at 10 million or more people needing help with their pets over the next year. We've never faced anything like that. Our total intake in the US of cats and dogs is only 6 million. So we're potentially going to more than double that if we don't do something differently. And you can see the reason I showed this is this was happening even prior to COVID, and it's just gotten worse since. And I talked a little bit too, we have many people being deported, being pushed back across the US-Mexico border. A lot of those people have animals, so that's caused a lot of challenges for us too, a lot of challenges during COVID. This little dog, his owner, he's one of my favorite stories, but his owner carried him from Honduras through 3 different nations just to get into the US, and they were separated at the border when she was detained, and we were able to get her dog back to her. But people are really desperate to get out of those countries. Their lives are threatened, and they often have animals with them. PACC faces a fair share of really horrible, hard things. These are a couple of our cruelty cases. Again, this is very commonplace for us, particularly cruelty due to neglect. And our officers only respond to emergencies. So we have 17 animal control officers for 9,000 square miles. All they can do are emergencies like this. They really don't get to do a lot of non-emergency calls, particularly in the summer. We also deal with a high number of hoarding cases. These are just a couple pictures from one of our recent hoarding cases. We frequently encounter people that have 50 or more animals. We don't have pet limits like you do in Australia. And so it depends on where you live, but you can often own as many animals as you want. And this is sort of what results from that. These are those same cats after they came into our shelter. All of those cats come into our shelter, they get medical treatment, and then they get placed through rescue or through adoption. And we do a great deal of outreach clinics because we found out that it was costing us $400 for every animal we brought in. So this is pre-COVID, and you see that line, that is all people lined up. That's at 7 in the morning. We had more than 400 people lined up that day just to get services for their pets. And that's one of our homeless families getting a service. Okay, so pre-COVID, this is sort of what we were doing. So in the US, just like you, we do field services and animal controls. We sometimes call it animal protection. And we do intake of lost and owned animals. When people can't keep animals, we take them in. We also do adoption and foster, medical care, pet retention, but I'm gonna focus mostly on the first two tonight, which I think are most relevant to you all. So COVID happened, and it was, you know, we, in the US, our government leadership was in complete denial. Well, not denial, they were downplaying it. And so we didn't respond quickly enough. And by the time we responded, there were already outbreaks. And there was one day when the government just shut down and we went on a lockdown order. But it was very confusing because it wasn't really ever enforced. But for our shelter, it meant that we had to change everything we did. And my fear, being part of the national groups I'm part of, my biggest fear was that we would end up closing our doors. COVID would be terrible. It would start to kill everyone. We would have to just start euthanizing animals because we couldn't open our doors to get them out. And so we did a national foster push, and we sent anywhere between 50 and 90% of our animals into foster homes because we felt they were safer in someone's home than in a shelter. We also closed our doors to everything except essential intake. An essential intake was defined as any animal with an immediate need that couldn't go anywhere else. So sick and injured animals, dangerous dogs, animals whose owners could not keep them no matter what. But we didn't take in non-emergency intake, and we asked people to leave all healthy, friendly cats, healthy feral cats, leave them alone, not bring them into the shelter. And we actually closed our doors to everything except for appointment-based services. So we reduced intake pretty dramatically in that first month. Our intake went to, and I'm going to show you slides, it went down to about 50%. As Noah mentioned, I sit on the board of the National Animal Control Association. That is a board of animal control leadership, and we make best practice recommendations. And so we authored a national recommendation that shelters stop taking in community cats and that they only take in dogs that needed to come in. And nationally, that pretty much was followed. And that's why you saw Steve's data. You could see that big drop. That was largely due to NACA partnered with all of the university veterinary schools, came together, and they aligned with us, and we made a big statement. Right away, we started seeing, I don't think you guys really ever had the kind of per capita COVID case rates that we did. Right away, as we started to see hotspots, we started to see people dying from COVID, and our animal control officers had to go out and get their animals. Or we saw people hospitalized who had nowhere to put their animals. So this woman in this picture, this was a great day for us. She's a homeless woman, and that's her dog. And she got COVID and had to be hospitalized and would have had to give up her dog, but we were able to board it for her. And by boarding it for her for a couple of weeks, she was able to get her dog back. And you can see she's got those backpacks on. Those are full of supplies for her and her dog. So that was our first COVID survivor who was able to get her dog back. So during COVID, we had a few goals, both at my shelter and nationally. Number one was just keeping people safe. So the other reason we wanted to reduce intake is we didn't want very many people at the shelter. And by keeping animals out of the shelter, we could reduce the number of people in. In my shelter, my state was the #1 COVID hotspot for 4 weeks. It had the highest per capita case rate in the nation and one of the highest in the world. And we did not have one single staff member get sick because of these protocols. So they really worked to keep people sick, keep people well. So we only took in animals as a last resort, and we tried to help keep animals with their family. And our animal control officers did that too. I'll talk about that in a minute. We also wanted to make sure we were maintaining public safety. So every week we were trying to track if there were more dog attacks and more dog bites. And what we found is that there have not been in our community or any others, there have not been more stray dog attacks, so dogs roaming free. There have been a higher incident of dogs biting people in their homes. And we believe that's primarily because people are just home more. And so we've increased the behavioral support that we offer people, and we have a behavior hotline to help people so that they don't get themselves into trouble. We also wanted to conserve tax dollars. I've already faced a budget cut of close to $1 million. And we wanted to continue to save our animals and also spread public awareness. That picture is included because that is an older, that's from 2017, but those dogs is a pretty common thing that we find. So right now our team is working on, our animal control officers are working on 15 hoarding cases. This is what they all look like. They're all anywhere between 25 and 200 animals. We had to stop bringing those into the shelter en masse and start to bring them in more slowly so that we didn't crowd the shelter. Okay, so gonna cover some really quick things, and I wanna make sure we have plenty of time for questions. So let me make sure I have a little bit more time. Okay, cool. Okay, so if you're wondering about our intake data, so this is our comparative intake data. We've been looking at how many animals we're bringing in. We're at about 50 to 60% of last year. And we're doing all of that by offering people more support to keep their animals in their home. So we're just asking people to hold on to animals when they can, and we're doing more to keep them in people's homes. So that is and I'll make this whole presentation available to you. I'm happy to share this, and there will be a recording because I'm going to go kind of quickly. Okay, so pets surrendered by owners. We take in pets whose owners can no longer keep them. There's roughly 4 categories, and I won't spend too much time on this, but we have a whole other presentation on it. If you take in animals that are owned by people, we did this thing for the first time. We broke down all the reasons that people bring in their animals, and it was so helpful. You can really see next to each type, those are the numbers for just a 2-week category of the owner surrender animals. So we broke down all the reasons they were bringing in animals to us, and we started to develop intervention strategies for each of those. So there's nothing we can do about people getting divorced, right? We're not gonna be able to solve every problem, but we can help if a dog is destroying the living room when he's left alone. And we can help if a cat needs some medical care. So we started to develop ways to keep animals out. And I'll just tell you, last month, we had 400 people come to surrender an animal to us. And we were able to keep all except 91 of them out. So we only took in 91 of the 400 that wanted to surrender, because we were able to give them support, and that support cost us less than taking in the animal. So we also deal with lost and stray dogs. We don't generally take in outdoor cats, stray cats, unless it is to spay and neuter them and put them back. But for dogs, we take in a high number of strays, and we do take in, pre-COVID, we did take in more stray cats if they were friendly. But this is a map of our community. If you've never done this, it's a great idea, because if you're running an animal control, you can totally change how you assign your officers based on these areas, and you can change the services you offer based on this map. So this is a map of my community, and the yellow hotspots are where more than 50% of our intake comes from. So most of our animals are coming from these hotspots. So we started to build programs specifically designed to target those places to keep animals out. So when an animal control officer finds a stray animal, the first thing they do is they try to get it home. They scan it for a microchip, and they don't bring it to the shelter. They scan it for a microchip, they see if it has a collar and tags, and if they can identify it, they take it home to the person, and we don't charge them any fees. We just take it home. And the reason for that is once that animal walks in the door, we're going to spend $200 to $400 on it. It's cheaper for us just to take it home. And then we can provide them some education about what the laws are. But we do return a lot of animals that way. And we also, in some cases, we actually drive people's animals home to them. And for the high intake areas, we actually proactively try to return animals to people. Our officers will actually hang flyers with the animal's information where the animal was found, and that helps get a lot more animals home. This is one of the most surprising studies we have seen, and it's really exciting. This is just the beginning of it, but a lot of the shelters in the US are doing it. So we're starting to survey people who find stray cats and dogs. And what we're finding is that if they try to find that animal's owner, they're typically finding it within 24 hours of finding that animal. So if we leave it up to the person and we say, we help them, but we don't take in the animal, they're typically finding the owner within a day. The other thing that we're learning is that the finders, when they do find the owner, 35% of those animals are found only a few houses away, and 26 are found only a few blocks away. And again, this was early, this slide was made early in this research. We've collected a lot more, and it's consistent with this. What we're learning is that cats and dogs are not going far from home, and people are really good at getting them home. If they don't just call us and they actually try to get them home, they're actually better at returning them home than we are. And so we're starting to try to work with that and develop new programs. So this is the flyer I told you about. Our animal control officers hang these flyers where they find dogs, particularly if they are large breed dogs or adult cats, and we know they're gonna be hard to place from the shelter. So our officers hang these flyers, and then people who are walking around looking for their pet see them and call us. And this is a great strategy. It works really, really well. And our officers, we got them printers for their trucks so they can just print them and then hang them. So we also have a dedicated lost and found position, and all this person does, I had to take one of my animal control officer positions. All this person does is try to find lost pets owners, and she's been able to double the number of lost pets we're returning home just by doing that detective work and putting that animal on social media. We're able to get a lot more animals home. We also provide collars and tags for every animal that leaves our care, as well as microchips. Those are all donated. And we provide fencing for people when they have broken fences. We provide them fencing, and a lot of companies will donate for this. And we just help them fix their fence if they need it, and then their dog stops getting out. So we're trying to tackle the root cause of the problem rather than the hamster wheel of intake and outcomes. I can share these documents in a way that you can use them, but these are the forms that we use. So if someone finds a stray pet, these are what we ask them to do. And for stray dogs, we bring the dog, what we do is the person brings the dog to us, we put a microchip in it, we give it a collar, and then we give the finder, we give them this document, and we tell them how to get the pet home. And then once they get the pet home, they give this piece of paper to the dog's owner so that then the dog is microchipped. Does that make sense? So they're not, once they get that animal home, that animal's now gonna have identification, and we can not make sure that we get that dog home if it gets out again. And again, I'll share these flyers in a way that you can actually use them, but
we realized at a certain point during COVID that we were telling everyone to bring every animal to us, and that people really want to help you. They want to help get dogs home, but we don't help them with that. We, instead of like helping them work within their own community, we tell them to bring the animal to us. And that often results in that animal never going home. So this is when someone finds a lost pet. So if somebody finds a lost dog, we'll ask them to hold that lost dog. And if they can hold that animal, we help get that animal home. So they'll hold it in their home for anywhere up to 3 days. We'll do the detective work to get it home, and then we'll get that dog home. Now, some people can't do that, and you tell them, oh, can you hold this dog? And they say, absolutely not, I'm bringing the dog in. We take those dogs, we don't turn them away. But more than half of the people, when you ask them to help, they want to. So more than 50% of people are saying, yes, I'll hold this dog, and if it doesn't get if the donor doesn't find it, I'll even adopt it. So it's been working really well. Okay, so specifically animal control. Okay, the picture, this old picture is from the old days of PACC. We were very punitive. We went around writing tickets to people and punishing people for everything, and we were charging people fees for everything. And it wasn't working. Our intake was just going up. So about 3 years ago, we totally changed our strategy, and we took this truck. This is actually the same truck, and we totally changed the look and feel of it. And we did that intentionally because we wanted to start to tell the community that we were there to help. We weren't there to punish them. We were actually there to help them. And we changed everything about the way we do animal control. And our goal was to prevent recidivism. It was to solve the root causes so that people didn't keep making the mistake. So these are our animal protection, our animal control officers of today. They now wear polo shirts. They still have the badge logo, so people know that they are animal control law enforcement, but they spend a lot of time helping people. So this dog here was attacked by a wild animal. His owner was a man who was financially struggling, and an older man. And so we got that dog, we took the dog in, and in the old days, we would have just taken the dog in and it probably would have been euthanized. But the man wanted his dog back. He just couldn't afford to treat it. So we took the dog in, we got it medical care, and then we drove the dog home. And our animal control officer did that. And we do all of that intentionally because that man has told, I've heard his story so many times. He's probably told 1,000 people about what PACC did for him, and he appreciates us a lot. And so we've gotten a lot more community support than we've ever had by taking this different approach. So these are our animal control calls. I know some of you are probably curious about this data, and I had to sort of put it in 2 pieces. But this is the types of calls our officers answer. This is in a month. So this is this past month. And you can see that our animal control calls have gone down a little bit. They haven't gone down significantly. And so the 2019 data is a little bit higher, but the 2020 data is actually mostly a little bit lower, but fairly consistent. So we're not seeing a huge change in the need for outreach services or animal control services. That has stayed about the same, and the community needs are about the same. But you can see we have a pretty high number of cruelty and neglect cases. And then these law enforcement assists are when the police call us and ask us to help them. So during COVID, we really had to increase our supportive services to the community. This is what our officers look like when they go into a COVID home. So they've had to go in, unfortunately, they've had to go into houses where people have died, and they have to fish their cats out from under the bed. So this is one of our officers who was on his way to respond to a house where the people had died. And they're often coming in close contact, and so they're in full hazmat suits, and they're fully protected to keep them safe. Our officers are wearing masks the entire time they're on the field. We are seeing an increase in abandonments. We're also interestingly seeing an increase in people being institutionalized for mental health crisis and for drug crisis. And we think that's because people are really struggling. And so we're having to help animals who are owned by those people. And we're not seeing any increase, again, in dead animal pickups, stray dogs, or bites. So this is a really quick example. I know it's nice to hear all the data, but it really comes down to every animal. This man, and we believe that our role really is to help people as much as animals at this point. So this man brought his dog to us. The landlord said the dog had to go. And the dog was sort of aggressive in the shelter. I signed off on his euthanasia, but my staff came to me and said, you know, this dog has an owner that loves him who had to get rid of him. And so we ended up learning more, and we called the owner and we asked him, if we can help you resolve your housing situation, would you keep your dog? And he was so happy. He doesn't speak any English, but we had one of our Spanish speakers call him. He was so happy. So we set out to help him get his dog back because the dog would have been euthanized. And it took us almost a month. The dog had to stay with us because the landlord, we had to call his landlord, and the landlord said the fence is broken, it needs to be repaired so that this dog can't keep getting out. So our staff actually went out and helped fix his fence. We took some volunteers. Every day, the dog was there for a month, which is a really long time. Every single day that dog was there, his owner came to visit him. He worked 2 jobs, and he worked one job until 4:30, and he would get off at 4:30 and come to see Brownie for an hour, and then he would go to his second job. But he was such a devoted pet owner, and that's kind of how we approach everything. We were able to get Brownie home with his dad, and he sent us some great pictures of him, so happy. But we recognize that COVID has made it maybe the hardest time in the world ever that we've known. And for a lot of people, the animal is the only connection they have to the world. Vlad doesn't have a lot of friends, and he doesn't have anyone else. He doesn't have close family here. His family's in Mexico. And so his dog was everything to him. And by getting the dog back to him, we're helping make a community where people do feel better, even though this is such a hard and scary moment. So animal services is having to change. I told you, I've been in government animal services for many years. And when I actually started in 1999 when most of what we did was euthanize. I started at a shelter where 99% of the animals were euthanized. We took them in, and if they didn't get taken by a rescue, they were euthanized. And we've come so far since then because we realized it wasn't working. Even no matter how many animals we euthanized, we weren't solving the problem. It wasn't getting rid of the community cats. It wasn't getting rid of the dogs that needed us. So we nationally in the US have changed. Government animal services has really changed to say we're gonna help people and animals. And we're gonna try to change this idea that animals are disposable. And it's working. So, so far this year, we've distributed 1 million meals to pets that are owned by people that can't afford to feed them. That is thousands and thousands of pounds of food that's all been donated to us. And we do 3 different distribution things in the community every week. And that's helped to keep out about 6,000 animals this year. So people haven't had to surrender their animals because we're helping them provide food. So many people have lost jobs here that the food support really helps. We also, I talked to you a little bit about foster, but foster is cheaper, it's more humane, and it's safer. We're housing about 80% of our animals in foster homes. We don't buy the food, people buy the food and supplies themselves. They help us get the animal adopted, but it's a cost-effective way to keep your animals in the shelter during COVID when you need to keep things safe. And starting a foster program is much easier than you'd think, even if you're a government shelter. Okay, so if you don't believe me, we did this big dogs and adult cats, big old unfriendly cats. Those are hard for us, and so are big dogs. So when COVID hit, this organization did this campaign, and what they did is they did Facebook advertisement, and they decided to advertise, we need foster urgently. Government shelters are going to have to euthanize if they can't find foster. And this map represents all the people who said that they wanted to foster an animal now when COVID hit. And it kind of makes me sad almost to see it, because we're missing, as government shelters, we're missing that our communities want to help us. And we're not making it very easy for them to help us. And I know that's hard to do, but we have a whole world of people that want to help us house these animals. And we weren't sure, we thought maybe these people would all just want to take puppies and kittens. So we did a survey with them, and 35% of the people said they would take a big dog, including a pit bull dog. And more than 50% said they would take an adult cat or an old cat. So that tells us that people really, really want to be helping. We also started providing medical support for owned pets. Again, we're in a very impoverished area, and so people are having to surrender their animals for like just silly reasons. So we've started to provide medical care. We've brought in about $500,000 in grants and donation to support these programs, because again, we're a government shelter, we don't have the money for that. So through donations, we're able to provide basic medical care for people who would otherwise have to give up their pet. With community cats, we spay and neuter about 4,000 community cats a year. We have this working cat program that we really love. When we have community cats that can't go back to where they lived, we adopt them out to homes where people need a cat, whether it's for a rat problem in a business or a barn home. And we get a couple of hundred cats adopted that way. And cats are treated just like dogs. Our euthanasia rate for cats is a little higher just because of kittens. But we save about 89% of them. And we treat them just like dogs. We treat everyone as an individual and try to save all their lives. So I am almost done. In conclusion, we've also developed a whole new range of programs since COVID. So we're boarding pets for people who have COVID or who have lost their job and need temporary housing. We're also doing intake to foster so that the animals go directly to foster care. We've switched to telehealth services for all of our medical appointments. So they're all done online so that the owner or foster doesn't have to come into the shelter. All of our services are by appointment now. We're not open. So if you want to bring in an animal, you have to schedule an appointment unless it's an emergency. And we're helping people find housing where they can keep their animals. So what has this done for us? In the first 8 months. In the first 8 months of 2020, we took in 6,500 animals instead of about 9,000 the year before. We maintained the 90% live release rate. Animals stay in our organization at only about 10 days. We've sent 2,500 animals to foster homes, and we've reduced our budget by about $1 million. So if we're successful with what we're trying to do in the future, as COVID, we know it's not going anywhere, we're trying to have 50% fewer animals entering the shelter, and we're trying to house the majority of them in foster care and to reduce the length of stay in shelter. We want to continue our core functions of serving the public and protecting public safety. And we want to increase the overall satisfaction people feel. We want the community to be even happier about the services we're providing now than we were providing before. And lastly, we're building countless partnerships with homeless shelters, domestic violence shelters, human social service agencies, because what we know is that those organizations tap into people who really need us, and we can do more working together. The next 6 months are going to be terrible. We are expecting a huge increase in evictions and housing loss. We're expecting increasing food insecurity, higher numbers of large dogs and medical cases and cats entering. We are expecting an urgent need for high volume foster care, and we're looking at potential for high rates of abandonment of animals, people just walking away and leaving their animals there. We are, though, seeing more adoptions and more foster placement than ever. So we have a waiting list now of 1 week to adopt, because there's so many people that want to take home a pet, because guess what? No one has anything to do during COVID, so why not have an animal at home with you? And lastly, I am on the executive committee of the Human Animal Support Services Project. If you are interested in what I talked about tonight, this is a great place. There is a website, it's humananimalsupportservices.org. And you can go to the website and learn more, but a group of 40 shelters are piloting all of the programs that I talked about and more. And with the effort of really changing our role in the community and putting a stop to the endless hamster wheel that is the government shelter of animals coming in and going out. So that project has about 500 subject matter experts from the field, and I'm going to be coming back in some capacity to talk with you all more about those programs at some point, hopefully. So we're really excited about that. But now we have a little bit of time left, and I am done, and I will turn it back to Nell and shut up so you can ask questions or make comments.
Yeah, go for it, everybody. If you've got questions, you can either pop them in the chat box or unmute yourself and ask away. We've still got a bit of time, so let's hang on to Kristen for as long as we can. She's been through a huge amount of information for us today. So thank you, Kristen. That was amazing. No questions from everyone? Everyone's mind's blown.
I think I packed it in too much. I knew I only had a little time with you guys, and I just wanted to get you as much as I could. So I'm also happy to come back anytime, or Nell can give you my contacts so that I can catch up with you. It's a lot, and it's kind of, I know as a government shelter, you're probably like, no way. And I used to be that way too, but having seen it both ways, when back in the old days, we just, you know, we're focused on just a few things to now, it's really changed. It's like changing how kids feel about animals. Like, we have all these kids and family coming to the shelter, and when they came into the dog pounds, you know, 15 years ago, they saw animals as sad, and they saw them as throwaways. And you know, I think it creates, it's like when you don't do these things, you kind of create a culture that animals are disposable. And I think now what our goal is like, this next generation is going to come into our organizations and say like, wow, like our governments and our communities, they really care about animals. And it's our hope that that translates to them caring more too, and us changing some of these. Okay, questions. How do we manage litigation regarding the rehousing of aggressive dogs? Oh, that's a great one. So I have done several presentations about this. It's probably one of the topics I feel most passionately about. As government shelters, I think we have a responsibility to euthanize a certain number of dogs because there are truly dangerous dogs, but I think it's a much smaller number than we think. So we have a pretty standard process for examining every dog, but we don't euthanize them based on things that maybe one minor bite or cowering at the back of their kennel and being fearful. We really try to put together a whole history of that dog. And then if we don't know the dog, but it's acting strangely in the shelter, we will send it to a foster home to get more information about it. But we try to learn as much as we can before we euthanize a dog. And we euthanize about 2% of our population for aggression. And the rest of them, our dogs go to play groups every day. So the way that we evaluate them is, when they first arrive, they go into a doggy play group and they meet other friends, and we try to co-house them together. So that question really depends on the level of aggression, but I do think we as an industry are remarkably risk averse. When you think about something like the vaccine industry or putting children on a school bus, and you imagine that those were handled the way that we handle dogs, we as a movement, I think internationally, tend to be more risk adverse and not consider the benefits of trying to help some of those dogs. Okay, as a government shelter, you work with not-for-profits. Was there an issue with you competing for them? Yeah, you know, so we have a friends group. We have a nonprofit arm that does our fundraising, because that is an issue for some government shelters. And that friends group is run by a group of volunteers. There's always competition for dollars, but there's truly enough resources to go around, and we try to work collaboratively. So we applied to some grants collaboratively with those organizations and try to work together to solve problems. But government shelters have not done enough to try to secure grant funding. And grant funders like to fund government shelters because they know government shelters don't get to pick the animals they take in. They take what comes in. And because they know that, they're really sympathetic to funding them. How do we microchip animals without owner permission consent? That depends on the state you're in. In the state I'm in, we don't need consent to do that. It really just depends on your local laws. A microchip is not going to, I mean, there's part of us that are like, well, okay, sue us. There's really no damages to microchipping an animal, so we don't have any laws that prohibit that here. How successful has the Will Work for Food program been? Oh, on the Working Cats program, it's so great because, you know, I came from a shelter where we euthanized almost every cat, and the thing about these programs is even if you're still euthanizing a high number of cats, you know how there's those cats that you're just so sorry that you can't get them home or you can't place them. I always recommend people start with those cats because there's cats that like will catch your attention and you think, I wish I had an outcome for that cat. And those are great cats to start with the Working Cat program, and people really love it. We have a wait list for people to get working cats. We live in a fairly rural community, but people really want them. And they have rules associated with them. They have to feed the cats. We make sure, we actually do, even though we release cats, we do also make sure they're not being released into ecologically sensitive areas. We are in the Sonoran Desert, which is one of the most biodiverse places in all of North America. It is a lush desert, so it's an absolutely amazing place, but it has many protected species. So we're really thoughtful about where we release cats to, because we want to do our part to protect the environment as well. Do you charge issues or fines to owners when animals come into your care when they're released? So it depends. We certainly deal with our fair share of really irresponsible pet owners or people that abuse the animals. And when we think somebody has intentionally done harm to an animal, we are punitive because our role is to protect animals from cruelty and neglect. But we also recognize that a lot of people just don't, you know, they don't really know the modern standards for taking care of animals, and they don't always, maybe they let their dog go one time or the fence broke down. And so we treat every situation individually. We do charge fees when we need to, but we try to give everybody the benefit of the doubt. And especially for first-time offenders, we don't typically charge them fees unless they've done something really egregious. Okay. As the animals enter the shelter, are you required to do a holding period or a quarantine period after the animal's been vaccinated? Is that a requirement under the US? Thank you for the kind words. So that's a great question. We vaccinate every animal on intake. That is how we prevent distemper and parvovirus and calicium and other contagious illnesses. So every animal gets vaccinated on its way in the door. And then our stray hold period is 3 days. So that animal gets held for 3 days. During that time, the animal can be pre-adopted. So someone can see the animal, meet the animal, and then the day it comes off of its stray hold, it can be adopted. So that's how we handle that. It's interesting, in some states, the law is different. There's stray holds up to 10 days. But research tells us that if someone's coming for an animal, the vast majority of those people will come within the first 48 hours. Have you had any experience with the trap, neuter, return program? Yeah, so we do trap, neuter, return. We do about 4,000 cats a year that way. And I wish we could just do more. We're an area with high rates of pet overpopulation. We probably need to do about 40,000 cats to get to where we need. And that's resource intensive. So we're a unique spot though. Most places in the US and other shelters where I work, trap, neuter, return has just worked amazingly well. And in Washington, DC, they're doing a study where they they take their trap, neuter, return cats, and they have these boxes, and the cats go in the boxes to eat. They're all over Washington, D.C., and the cats go in the boxes to eat, but they take 3D photographs of the cats. And they're learning so much about the cats that way. They're learning how far they travel, and that study is about to come out. I'll share it when it does. But we know that where trap neuter return's been done successfully, it works great. We just have such a high volume. We're still just trying to chip away at those numbers. I think that is it. Did I miss any of these? Oh, yeah, there's some, I try to talk a lot, and I had the opportunity to come to G2Z, which was one of the coolest things I've ever gotten to do in my life. And I recognize that there are some unique differences about Australia, and I know that our laws allow us to do some things yours don't, but I will add that that wasn't always true. Those laws have changed, and one of the things that I do is write ordinances, write local law, and those laws have changed because people like us have changed them. And some of the laws still need to change. Some of them are just built for a time when really our whole job was rabies control, right? We were there to control rabies, and that's simply not the case. We have rabies vaccines, and rabies has largely been eradicated in most places, at least in the first world countries where we work. So a lot of those ordinances do need to change, and we need to do it. And it doesn't mean they're not still focused on public safety and a moderate approach, but there is so much more we can do.
All right, well, thank you for all of those fantastic questions, everybody. They were really great questions. And if you want some more information, I've put up a couple of links in the chat box, but if you're wanting to find out more, then send us an email or hit us up on our Facebook page Messenger, and we'll get into contact with Kristen and get that info for you. But I wanted to say a huge thank you, Kristen, for joining us tonight, your evening, yesterday evening, whenever. Go and relax. We really appreciate your time, and it's been a super interesting presentation. We can't wait for the next one. Thanks very much.
Thanks so much for having me, everyone, and thanks for being amazing. And it's so good to see your faces in the midst of all this craziness. So I hope to see you all again soon.
Thanks, everyone. Take care.